Hi, good morning to everyone watching this morning. We are glad to have you here today. We're having Sister Banula Gertrude all the way from Lubaga Hospital, and we are here to discuss yet a very important aspect this moment. Before I bring in the sister, let's first reflect on what is happening in our society today. I believe you and me have heard or seen a woman die or read about a woman dying in the recent past due to pregnancy, complications of pregnancy, or actually in the actual act of giving birth. If you've been keen in the papers, you've read about a prominent musician who died while giving birth. You've heard about family members, I think, or family friends in your circles that have struggled giving birth. Now, everyone is looking for solutions. I believe that sometimes it is on a bigger part, maybe on the patient or in their preparations, to a limited extent, maybe with the delays in the transportation movement of these pregnant mothers between home and hospital or facility where she's going to give birth from. But in the rare and very few cases, maybe on the side of the medical workers. Sometimes if we are to handle those problems, we need to examine all parts and to properly understand who was supposed to do what and when. But before we get to the period of giving birth or the time of delivery, we also need to look at how well do we prepare mothers for actually these pregnancies. And today I'm glad to be joined by Sister Banula, who is going to help us understand and take us through that journey of pregnancy. But we know pregnancy only lasts for 9 months. But the period before pregnancy is also very important. We are going to have a positive interaction. Feel free to leave your questions in the comment sections, and we shall be able to go to those and respond to you before we leave to make sure we are all on the same page. Again, good morning. My name is Mr.Selfcare, all the way from Mr.Selfcare Studios. Our role is simple: to pass health information to you, to help you make better health decisions, to make sure you reduce on your health care costs, and to promote your life. Sister Banda, good morning.
Good morning, sir.
How is Lubaga Hospital and how is home?
Lubaga Hospital is fine. They send greetings. Home is warm. They are very fine. Everyone here is okay.
Yes. Please remember to send regards to your dear husband for letting you and buying you data to make it to our studios. We know behind every smiling wife there is a hardworking husband. So
I know.
yes. So Sister Banula, first of all, we are saddened by the recent numbers of women having challenges during pregnancy or actually giving birth. Before we go into that, who is Sister Banula and what do you do?
Okay, thank you very much, sir. I am called Banula Gertrude, a married woman with 4 children. I've worked with Lubaga Hospital for the past 15 years, and I'm a midwife. Yes.
Wow. The point of 4 children, I tap the blessing.
Amen.
Amen. Sister Banula, let's talk about the journey of pregnancy. For so many people, pregnancy starts the day they tell them, oh, you're pregnant or you've missed your periods. But what are the most important health checks for couples before trying to conceive? Because I believe this is also important.
Yes. Thank you very much, sir. When we talk about pregnancy, there is a bit, most of us, especially African women, we miss out. It is the preconception care. We miss to prepare ourselves for the pregnancies. Most pregnancies, they are accidental. You just get to know that, yes, I'm now pregnant, and you start from there. But it is advised that all women, especially childbearing age women, should have a preconception care before they consider getting pregnant. Yes, there are some checks we do. Preconception care is a period before a woman gets pregnant. Yes, she has to check her health. Is she healthy? Does she have chronic illnesses like diabetes, hypertension? The behavior changes. Is this mother smoking? Is this mother is she in alcohol? Does she do drugs? So before we consider getting pregnant, we have to check all this and make sure that this candidate is good to go for a pregnancy. Yes.
Okay, so uh, you say that actually preconception care is very important because we need to find out if actually this lady is ready to have this child. Just like someone planning
Yes.
to build a house, they first do a survey on the land. They see if there is suitability. They get a plan. I think that's how I would relate it to preconception care.
Y-
Uh,
Yes.
in your experience and expertise, what are some of the checks that you think you've tried to hint on a few that you would advise or you would think every couple should try to like consider before actually they go in? For example, me and my wife are planning to have a child in the next maybe 4 6 months. What do you think we should check out for?
Okay. Before we get pregnant, the woman is
Yes.
advised to do a background check on herself, to check for the chronic illnesses, as I said,
Mm,
diabetes, hypertension,
mm,
sickle cells,
mm,
HIV,
mm,
hepatitis B, syphilis. These are the
mm,
infections now. The
mm,
mother is advised to be taking folic acid to prepare her body for the pregnancy, because folic acid is crucial, or it is key in the
mm,
development, in the early development of the fetus. So if the mother
mm,
takes it early, it help
mm,
it prevents these birth defects we'll see on our fetus.
mm,
If the mother is a smoker, she's
mm,
advised to quit, to first go
mm,
slowly, then quit when she gets pregnant, and pre alcohol consumption. Yes.
mm,
So the mother is also advised to do some physical exercises, because sometimes when the BMI is high, there are risks of infertility. So we advise her to do some physical activities which can help her to reduce on the BMI and to be fit for a pregnancy. Yes, we check for
mm,
immunity. If the
yeah.
mother has never got any immunizations like for measles, rubella, hepatitis B, tetanus, um, even now COVID. In some other countries, they're still immunizing COVID. Yes, we advise her to take those routine immunizations before she conceives, so that she makes her body perfect or suitable for a growing pregnancy.
You've mentioned so many things, but among them you've talked about folic acid. I think, sister, I'm going to ask you to throw more emphasis on folic acid because this is something. I used to work in ultrasound scanning in Mulago Hospital and Naguru Hospital for the last close to 10 years, and one of the things that I always was surprised when was dealing with pregnant women is that some women would come close to 6 months into pregnancy and they have never taken a single tablet of folic acid. And some of them kept saying, naye ne bajjajja baffe tebaamiranga folic acid.
Tebamiranga kituufu.
Yes, why should we take them? So, sister, elaborate
And
more. Why is folic acid important in this period of actually in the preconception care?
folic acid is very important because it is one of the essential drugs that we need in the formation of the neurotube, or to prevent the birth defects on our fetus.
Okay.
And it is supposed to be present in the mother's body before
Mm,
there is conception, before
mm,
the eggs is fertilized in her body.
okay.
Yes. So all mothers, we are advised, all of us, to be taking folic acid at least a month before we conceive, or a month before plan to get pregnant, so that it is there, the baby or the egg find it ready in the body for use.
Yes.
Yes, so it is very crucial, and all mothers are advised, even in our guidelines, antenatal guidelines, the Ministry of Health advises us that a mother is supposed to start antenatal the day she knows that, yes, I'm pregnant. And starting antenatal does not mean that she's supposed to come to hospital. She can be at her home, but when she starts taking her first folic acid tablet, it means she has started her antenatal journey. Yes, so it is very crucial and it is very key to reduce on the many birth defects we expect to get from mothers who don't take folic acid.
For friends of ours who are asking themselves what a neural tube defects, when we talk about neural tube defect, we mean things like spina bifida, in my local language, or a bango. We are talking about things, brain defects like hydrocephalus ventriculomegaly, where the child is born with a big head because there is increased accumulation of fluid. Abaana be bazaala nga balina emitwe eminene. We are talking about having defects on the spine or holes. So all these things are qualified to be called neural tube defects. And sister is here re-emphasizing that you taking folic acid in your body as a mother actually helps to reduce all these. Sister, how can lifestyles such as nutrition, exercise, sleep improve fertility in both men and women?
We all know abaganda bagamba gava mu kulya. Yes, so all the nutrients we need, we are going to get them from the foods that we eat. That's why we
Yes.
emphasize all childbearing age women. They're supposed to have a good nutrition. When we talk about a good nutrition, we talk about having a balanced diet, having the carbohydrates, proteins, and vitamins stroke minerals. In these vitamins stroke minerals is where you're going to find these essential vitamins we need, we as women who are going to conceive: the folic acid, the vitamin C, the vitamin E, the other, the vitamin B12, the other in these fruits and vegetables, other fruits and minerals that we shall be taking. The proteins, they enable the body to have the nutrients that will help the baby grow well, the baby develop better. Carbohydrates, the body will have energy to hold this pregnancy and to accommodate the different hormonal changes that we are going to see as we go along with the pregnancy. Yes, so all these food values are needed as before we go into pregnancy, because as you know, malnutrition in women is dangerous. It means that even this growing fetus will not get all the essential nutrients. So the baby will be malnourished even as he or she is still inside the mother's womb. So it is key because the mother will have will will share the nutrients with the baby before the baby is born. And lifestyle like exercises, alcohol consumption, the drug use. Yes, lifestyle is key also. As you know, a healthy body prevents many illnesses. So if the mother is having these exercises, she's going to have a healthy body, she will have a normal BMI. There are reduced complications of these diseases, like complications like high blood pressure, diabetes, because the body is active and healthy. And this consumption, alcohol consumption, tobacco, taking of cigarettes, it is you increase on the toxins in the body, which will make the body hard to make the baby grow better inside there. So we reduce on those, or we stop on them, and we encourage the mother to do more exercises, to be active. Yes, as she's having a balanced diet.
Sister, you've talked about so many things, and being born from a Catholic family where we eat and drink everything. Let's also talk about as smoking and alcohol. Um,
Eh,
how does alcohol and how, in just a minute or even less than that, how does, in summary, how does alcohol and smoking affect a child, and how is it dangerous in pregnant mothers?
Alcohol, these are toxins we are introducing in our body. And as you
Yes.
know, toxins, they're going to inhibit the full development of the fetus.
Mm,
Yes, so we inhibit on them for the development, for the proper development of our fetus. And the bad
mm,
thing with alcohol, it can go even direct to the baby's brain to cause
mm,
it depresses the respiratory centers there. So you
mm,
can the baby can be born. There are babies we call alcoholic babies. When the baby is born with complications of alcohol consumption from the mother.
mm,
The baby does not have appetite, low weight for age.
mm,
We know the baby is supposed to be 2.5
mm,
average, the minimum
mm,
weight, but the baby
mm,
can even be like one on when the baby is even term, a term
mm.
baby, but with a low weight for that for delivery. Yes, that's the reason
Okay.
why we tell the mothers to not to take or to consume alcohol during pregnancy.
Sister, one thing that again stands out for you, as who know you, you're still young and you've already had your 4 children. Now we have
I'm old.
these so-called professional women who do not want to have children until they are too old. How does, now that we are looking at the complications and the reasons as why we are having number of actually women struggling to have children, or even some losing their lives during birth? How does age affect, number one, fertility, but also the life of this pregnant mother, and how does actually giving birth in when you're old most likely to affect your pregnancy journey?
As you know, as women, our lifespan is gauged by the age we are in, because our
Mm,
lifespan is gauged on the fertility rate. They say
mm,
your clock is ticking, your clock is ticking. So the
mm,
older you get, the more things become complicated in childbirth. It
mm,
means that the older you get, your fertility rate is going to be lower.
mm,
The body is getting weaker. Um, if the body is getting weaker, it will not be able to accommodate the pregnancy. And as you
mm,
know, pregnancy and itself, it's hormone based. There are many hormones that play
mm,
part for us to conceive
mm,
and to keep this pregnancy. So if the
mm,
body is weak and we we subject it to all these hormones, it will be
mm,
more weaker. So it is advised for us to have children in the right ages, that is 25 to 30 to 35.
mm,
The mother should
mm,
have started giving birth, not
mm,
having the first child at 30, 39, 40. The
mm,
body is
mm,
tired, the body is weak now. Yes,
mm.
and the hormones are low. They'll be low in production because we are nearing menopause. So the more we near menopause, the less hormones that you are going to be getting. So it means that our fertility journey is reduces as we grow older.
Yeah, and again, actually, you were talking about this, and I was surprised that even when we go, some of us who are farmers, when we go and you want maybe to buy a goat or a cow, you first ask Inezale Meka Eraya Bangach, like how old is it? Because we don't want
Yes.
to buy an old ones. But in human beings, again, especially the so-called educated class, wants to wait until we get so old. The body ages. Someone told me that there is a mathematical age for women and a biological age. Now, the
Age,
mathematical
yes.
age you can tell. whichever age you want, but it is a real biological age that keeps ticking every day, every day. So
Yes,
to every woman that is watching in through, the longer you wait, the more complications you're going to have.
you're going to
Last week
get.
we were talking with Dr. Paul Chivenge, and he said that when a woman gets to 40 years, the quality of the DNA in their egg actually reduces. So you're increasing chances of having children with Down Walker syndrome, but also
Downs,
other, yes, Down syndrome, but also
gen-
other genetically related
genetic
complications.
complications.
Yes. So, sister, moving away from that, let's talk about emotions and then psychological preparations before couple, especially couples that are going to have children for the very first time. No, there are those emotions that keep running, especially if you delay to have children due to some reasons or the other. How does that affect pregnancy, and how should we handle them as new couples, or even couples that have for some reason delayed to have pregnancy?
Now these days, mental health is emphasized in everything that we do. All of us have to be mentally stable to to take on everything in life. And pregnancy, as I said earlier, with these uh, hormone hormone complications that you are going to see because of the increased this, the reduced that. So the body experiences a lot of challenges. So the couple is supposed to be educated or sensitized on the likely problems that are likely to be faced because of the upcoming pregnancy or for the conception that they're planning to have. So we emphasize they keep a social and educational life whereby they get informed and clear information which is not compromised. We emphasize on the social behaviors to be with people, to interact with people who are in the situation that they want to enter or which they're in already. Yes, and we encourage them to have more time and speculate on it, to really know that yes, we are in for this and we shall handle it with the educations that they'll be getting from the different people that they meet along the way, the health workers, the peer mothers who are pregnant or who are planning to get pregnant also. Yes, it builds their social life and it reduces on the stresses that they might get because of the complications which are brought about by the pregnancy, uh, labor, and post delivery.
Sister, you've talked about peer mothers. How important is my girlfriend or wife that is planning to get pregnant to join classes of other pregnant women? How is that important to help her deal with emotions and psychologist challenges?
When you see someone who has passed through the things that you see as they are challenging, life becomes, it is not going to be very easy, but it becomes easier. You feel that yes, if other people can handle, I can also handle. Like for us in Uraga Hospital, the family
Yes.
planning clinic, immunization clinic, adolescent clinics, they are in the same they're in the same they're in the same space. So when an adolescent comes for services, she will see a pregnant mother, who is having the first pregnancy for the first time, will interface with a mother who has come for immunization. So this will help them mingle and get to know that yes, things are workable. Even to be soboka, not to be like they are the only people who are facing this for the first time.
Okay. So,
Yes.
sister, thank you so much for explaining that. I think Rospa and Kim Brenda, who are planning to get pregnant, you're listening in. You should be looking out for all those pregnant women in your society to start preparing. Let's talk about
Eh,
finances, sister.
mm,
There is a challenge of women wanting to give birth in certain hospitals, but the husbands
mm,
cannot financially afford those hospitals. what's your advice, and how can you, because we are talking about preparations, I believe some of the things actually that bring complication is if you want me to give birth in hospital A, but I cannot afford. So we are staying in Wakiso, but you want to give birth in a hospital in Kaolo. So during those transportation in and from, maybe I think that's where we have delays, that we're having mothers give birth on the way, or even mothers losing life. Talk about financial preparations for pregnancy, and how can couples save in preparation for pregnancies or handle the financial issues?
Finances are key. As you know, ataina sitendita kumitalinda azimunaye. Na ye,
Ah,
the thing is, money money is key in most of the things that we do. But what we all know that we have different financial capabilities. We are not at the same level. So we advise
yes.
couples, there is what we call a birth preparedness plan. So when we are pregnant, the first antenatal, we go through that birth preparedness plan. We ask these couples, where do you hope to deliver from? So they will say hospital A. Do you know that hospital A, you have to pay such amounts of money? Are you prepared for it? So as they go along with the pregnancy, they come to an informed consent that two people, the husband and the wife, they say, okay, we want this, but we might not afford this, but there is this that will work better for us. So through the birth preparedness plan, we go through all that, and they get to really know. By the time they come to give birth, they have they have planned on which hospital they'll go to, how much money they'll be needing, and how they'll get to that hospital in terms of transportation. Well, because in that checklist, everything is there. How will you reach hospital A if you live in Wakiso and you want to deliver from Kawolo? How will you reach Kawolo? Do you have a car? Do you have a standby boda guy? Anything like that. Yes. So as the mother starts her pregnancy, usually we talk about finances in our health education talks, because as you know, in Uganda, I would say, because it's where I've been most, before any activities done in antenatal or in antenatal, we have a health education talk. So in one of the health education talks, we talk about we advise these mothers to start keeping some money for to aid them as they are giving birth in that labor period. The money that will help them transport them to the hospital, the money that will be used as the husband comes, you have to have some money with you. So we advise them that every day, as you eat food, before you eat, first put aside something small according to what you can afford. If you're going to use a hospital government for delivery, still you need some money for other commodities like airtime, baby's pampers, your food, your transport to the facility, your transport from the facility. So we advise them to keep aside a small amount of money according to how she earns, so that it can aid or it can help her when she's in her labor period.
Okay, again, I'll use that example of us, the farmers, that when you are having a pregnant animal, you do everything that is possible to make sure that actually the animal is prepared. Like you prepare yourself, you know when it's going to give birth, you know everything that you need. But when it comes to human beings, we always want to assume things are going to be like, we don't want to take that extra caution. So to all couples planning, pregnancy is a journey. Just like you say, I want to go somewhere in the next period of or whatever, you buy an air ticket or you apply for visa or you save some money for that. And to the side of men, let us stop acting like we didn't know pregnancy was coming. You know, it's what annoys me the most. Like, you wake up, you decide to do what you do, you get this young lady pregnant, and now you start to act like everything was a miracle that just dropped in heaven. Even Joseph, the father of Jesus, when was first an angel told him, please don't run. Mary is going to be pregnant. So let's stop acting like it was a Holy Spirit pregnancy. Let us plan things before, and let us also look at accessibility and affordability. Yes, you're next to an international hospital, but is your standard of that international hospital? I always tell people that if you're not going to a good private hospital, I would rather advise you that you go to the nearest government hospital to you familiarize yourself with the nurses rather than taking your antenatal in the most expensive hospital. Then when time comes for giving birth, then you go to a government hospital, you start insulting people, you start asking for private services in a government hospital, you start telling them how they are delaying, how they are doing things, because literally you walked your whole journey in a private facility. Now you want to go to a government facility. Lastly, sister, there are so many myths about getting pregnant and misconceptions. But before, the men have always been asking me this thing, sister. What is the relevance of men escorting their women for antenatal? One man asked me that it is my wife that is pregnant. Why do these midwives keep telling our women that we escort them? Nange ndi lubuto bagenda kunchekinga. Why is it important that men come at least twice, 2 times for antenatal together with their women?
Um, it is their pregnancy. The pregnancy is not only for the wife. The pregnancy is both. It has both their genes, the man's sperm and the lady's egg. So we are supposed to be in it together. But the most important thing why we tell men to come along with their women is to sensitize men on the different changes, the changes that are happening in the woman's body, for him to embrace them and to know how to go over them. We all know, I don't know whether you have children, but for us, the first pregnancy we had with my husband, it was challenging. Yes, I would say, because most of the things were new. You're vomiting here and there. You get annoyed quickly. You don't sleep at night. You're spitting everywhere. You get annoyed quickly. So there are a lot of changes: psychological, emotional, physical changes. You're growing bigger every day.
Yeah.
The nose is bigger than the time he conned you. The nose was very small. Now the
Yeah.
nose is covering the whole face. So he doesn't know
Yeah.
what is happening. And you also cannot explain what is happening to you. So when the husband comes along with the wife, all this, the man is going to know why they are happening to the wife's body and what to expect in the near future and what to do in case some things happen. Like we talk about the danger signs in pregnancy. Some danger signs the mother will not be able to see them herself because she'll be in it. Like when the mother, these preeclampsia mothers, when they get this eclamptic fit, she will not know that I have got an eclamptic fit. But it's the husband who will know that I saw my wife fitting. She got a conversion. She got 205. So he'll be the one giving the history to the health team if he knew the danger signs. So when he comes along with the wife to hospital, he'll be able to identify risks or complications and know what to do. And these are the things that happen that we cannot do anything about them, but you know how to overgo them. He will understand more. And another thing why we tell the husbands to come is to screen for diseases which are communicable diseases, HIV, syphilis. Yes, when we screen, we get to know that our infant is not exposed or the infant is exposed. Because in HIV we have discordant couples. The husband might be HIV positive, but when the wife comes for the first antenatal time, she's HIV negative. So when you get an HIV negative wife and the HIV positive husband at home, you will not know that the baby is exposed. But when they come together, the wife and the husband, and you screen both of them at the same time, even if the mother is HIV negative, we shall be able to protect our infant or our fetus, which is still growing this mother, because the fetus will be exposed just because the father is HIV positive. So those are some of the reasons why we tell these husbands to come along, even the financial bit of it, because most of the things here in Uganda, we have to pay for them, even if you're in a government facility or in a private facility or in a VVIP facility. Most of them are payable, especially the tests that we do, the investigations which are carried out during pregnancy. So if the wife comes along alone, the husband may think that this wife wants to steal my money. She's taking a lot of money. Why is she asking a lot of this and that? I got a scenario. I usually get them.
Yeah.
Husbands who bring the second wife or the side chick. Now the side chick is pregnant
Ah,
and the wife has delivered like 5 of them. So one day a man asked me, "Hey Musau, all this money you're asking, my first wife never took all this money. In antenatal I paid like 6,000. Now you're telling me I have to pay for the anti-D injection. What is anti-D? What
yeah.
is the problem with the mother's blood? No, 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 no. These things, there are things you have to check. My first
Yeah.
women, they even labor, I would pay only 20,000 for delivery. Now you're telling me we might go for a cesarean section. Why are you planning cesarean section when we are still in antenatal? So
Yes.
when they come, they get to know all this and why they are paying for them. So he got to know that the first wife, the rhesus factor was okay, but this side chick he got now has a negative rhesus factor, which is going to pay. He's going to pay more money for the baby to be inside the mother's body for the anti-D injections, which are given like 3 times during pregnancy, for a complicated labor, a complicated postpartum period. So when he comes along, he gets to appreciate all this. And that's the main reason or the core reasons why we ask the husbands, please come along with your wife so that you appreciate all this.
Again, you've talked about so many things. I re-echo one thing where you said it is important for husbands, especially the noses. It is a way the noses become bigger during pregnancy that most of us men have failed to understand. Enyindo inengeri ezimbamu, and yeah, but I agree with that. That if the man is mentally prepared, then sometimes it becomes easier for you to understand and to appreciate that situation. You've also talked about side dishes. Kwegamba side chick, kwegamba side chick taina advantage yenna mu nsi muno. Buli kyebogera
Nedda alina.
ku side chick kibeera kibi. So to my fellow men listening in, please drop the side chicks. Let them become main wives somewhere. Sister, going on with this discussion is becoming actually very interesting. I hope the young couples out there are listening, because this is very key. This is very, 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 very important. I have one daughter, and I remember that pregnancy also, there are so many things. My wife would ask for very complicated things. There are times, I mean, she didn't want to look at you, but she doesn't want you to go away. So you're calculating, should I don't want to see you, but don't leave that door. So you're in between there. But understanding and going through these classes prepared me mentally to accept that. But also appreciating that this is a journey of a couple. I think I've seen more strength and more courage and positivity in women when they move with their husbands coming for these antenatals than those women who normally come alone. I said I used to do a lot of obstetric ultrasound at Naguru, but normally if the husband came along with the women, there are even some there are some things that a husband would, I mean, maneuver. For example, normally when I saw a husband standing with a woman, what came to me was always that this man needs to go back to work. So for some reason, I always found a way of working on this couple such that I have the husband go back. I mean, imagine, I wouldn't love to mention, but imagine a border guy parking his motorcycle for 2 or 3 hours escorting the wife. To me, normally what would come into my mind is that I need to set this guy go back to place of work, because that's the same favor I used to receive when I used to escort. When I used to go maybe for a few times with my wife for those antenatal visits. And I've also realized that to men, that money enough is not, money alone is not enough. Don't just get money and give your wife, oh, I gave you money to go for private. Those times that you go there, those are the moments that she's always going to remember each time she's facing a challenge. And actually, I regret all the times I missed escorting my wife when we were preparing for our daughter. I say maybe those are some of the things that maybe when things are not going bad, that she's going to look back to and say, okay, but this guy was there during these moments. Because, in Africa, generally outings are rare. Men don't want to take their women out. When they go for weddings, Singapati and now we've gone out, we went for that wedding. No, men, take your women out on official outings, not just weddings or introductions. Sister, back to the topic of discussion.
Yes.
We've now moved away from preparations to actual pregnancy. And this is where some of the young generation or young women have a fear. What physical changes should women expect during the first trimester? And when should they contact a healthcare provider?
Okay. The physical changes, we shall have, as we talk about physical things, these are things that we are
Yes.
going to be able to see by our eyes.
Yes.
Some of them are good. Some of them are good, some of them are challenging, and some of them are scary sometimes. But
Yes.
we can start from up, down. Yes,
Yes.
systematically. The lady, when we're in our first trimester, is the first 3 months of pregnancy. We don't expect much of the changes. Most of the changes would be psychological inside there because of the hormone changes. But now, when we go to our 4th month there, the mother is going to get a pregnancy glow. Akanyiriro k'olubuto atandika okulabika nga afuuse, alabika bulungi. Yes. Kubanga by that time, from the 3 months, the vomiting has reduced, spitting has reduced, the annoyance is now not so much because the hormones are now balancing from the first 3 months. Yes, so
Yes.
she'll get that glow. She'll get, some mothers will get more darkening of the skin. It's called chloasma in science. But you can see some women when they're pregnant, they tend to have a darker neck. Or if she was brown, she becomes darker. If she was dark, she becomes more lighter. Yes, and the neck, most of the time it's very dark, like she's not bathing well. One of the husband asked me, "Ne mukyala wange takyayagala kunaaba, laba ye ensingo weekute."
Kalibala.
So it's not because she's not practicing her hygiene very well. It's due to the hormones now, which are making her body to change physically. The breast will become more larger, more firmer, and the areola is the dark circle around the nipple. It will become more darker and bigger than in mothers who are not pregnant. This mother will put on some weight. If she used to be 35 kilograms, 47, she'll be increasing in weight. Every month, we shall be seeing an increment in weight, at least 2 kilograms for a normal weight gain. Yes, the abdomen now. The abdomen is going to be more bigger, and it is going to be growing slowly, but you'll be noticing the growth. It will become more larger. And on the abdomen still, we shall see some dark linings we shall see the linea nigra. If a man has seen her wife, sometimes it's hard for us women to see ourselves unless we're in the mirror. You'll see that line becomes more darker, like the areola on the breasts, stria gravidarum, like stretch marks on the abdomen because of the enlarging of the what? The abdomen. And our private parts will become more bigger and more warmer with increased fluids because of the increased blood supply to that part, and the increment in the mass or the muscle for the private part is it's because the private part is being prepared for childbirth. So it will become more, we shall get more muscle inside there, even outside, and more warmer and with too much fluid just because of the too much blood supply which is going in that space. Uh, Other parts we can get like the legs will become, sometimes they become big, or we get edema in them. Edema is whereby we have excess fluid going in the tissue of the legs, but not with all women. So this comes because of the weight that we are carrying most of the time, but we have to screen for other uh, other diseases which can cause the edema to come in the legs, like the high blood pressure. Yes, and the nose. I've not talked about that nose, but the nose will actually get bigger. I don't know the science behind the nose becoming bigger, but what I believe, what I think, it could be
Yes.
because of we are now getting in too much oxygen because the blood is the heart is now bigger because it is pumping a lot of blood to the body to the other bodies, to the other body parts, and to the baby now. So I think
Yes.
the the nose becomes slightly bigger just to accommodate more air inside to sustain that need inside the body there. Yes,
So,
mostly those are the physical changes we can see as.
yeah, thank you so much, Sister, clearly explaining that, because I believe so many times this actually worries a lot of young people, especially those that still want to look sexy or still want to maintain a certain body size. So when they think about these enlargements of different body parts, sometimes they are scared. But again, I'm here to pass out a knowledge that these are things that will only happen for 9 months. Immediately after giving birth, you're going you're going to go back to your normal size depending on how
Yes.
you work out. Sister, you've talked about so many changes that come. Some are good, some are bad. Yeah, there is that kanyirido, that nice looking like appearance that normally comes on pregnant women that all men will love. You know, you start bragging about, say, my wife is pregnant, my wife, before the nose sets in. Normally the nose will come in later. Normally
Yes.
the nose will come in later. Sister, how can a mother out there watching this program that I started experiencing things like nausea, fatigue, and mood swings somehow try to manage these things? Because yes, I understand, sister, that some of the things are uncontrollable and you have no, like, they are happening naturally. But sister, sometimes it becomes too much. The vomiting becomes too much. The nausea becomes too much. But also the fatigue. What advice would you give to a woman watching in right now on how safely they can handle this?
So those, we call them minor complications during pregnancy. Minor complications, these are complications that are not harming the mother or harming the baby. As you say,
Yes.
these things are there that for a limited time, a very short period of time, 9 months to experience them. So if the mother is getting nausea, we advise her to get something she can be chewing on, like we advise her, you can get some hard corns, some maize, uh, this hard boiled maize, things which are not too sweet, not too sour, just there, which have a, how do they still taste, eh?
Mm.
Yes. And with pregnancy, you're going to eat them, and you're going to reach a time when you cannot even see the hard cones. You feel you're
Mm.
fed up of them. So we tell her you're going to be changing. If you're fed up of this, you get another thing. As the nausea,
Mm.
as time comes and you have overcome all this. Fatigue,
Mm.
remember, the body is overworked now. It is taking care of you and taking care of the growing baby. As the baby
Mm.
grows, the body becomes more weak. It is carrying a lot of weight and it is doing a lot of activities to maintain the baby and you. So we advise the mother that you're not going to be so active like as you would be when you're not pregnant. Kindly
Mm.
accept this. Get some time in the day and rest your body. Get
Mm.
someone to help you with strenuous work,
Mm.
like some women, they are the ones they are taking care of homes. You're washing
Mm.
clothes, you're washing things, you're cleaning the house, you have to go to the
Mm.
garden, and you feel the body cannot do all that. You can get someone to help you with those activities that you feel you
Mm.
cannot you're strained, you're overstrained doing them. But as you know,
Mm.
the fatigue will not come in when we have just conceived. The fatigue will come
Mm.
in when we are about to deliver. So it will be for a short period of time. And we tell her,
Mm.
kindly, kindly accept it. And if the husband is coming along with her, we talk to the
Mm.
husband to show him where he needs to support the wife, because the wife will need support at home or even at work
Mm.
if the man can afford to help her with that. Yes, so we just see how we can overcome these minor complications, because as I
Mm.
told you, they're not a harm, they're not a
Mm.
threat to the baby, not
Mm.
a threat to the mother, but they are there just because of the hormones which are helping in sustaining the pregnancy. So we just see how can you overcome. Is it the nausea? Get something to be chewing on every time, or drink something that is not so bitter, not so
Mm.
sweet. Every time, make sure that you have something inside the mouth. If it is
Mm.
spitting, the same thing. Don't spit, because sometimes some mothers they say, I'm going to be spitting. They move around with bottles which have ashes every time that. So so we advise them not to spit, because whenever they spit, they're making the situation worse. Because as you know, saliva is like tears. When you're just starting to cry, the tears are small. But when you cry, they're going to be much. So that's how saliva is also. So when you start spitting, first time, next time you'll take like 2 minutes. The next time there will be seconds. So we advise them not to spit, to be eating on something, and not to chew things that are not food, which are not going to go to the stomach. Because when they
Mm.
chew and they don't deliver in the stomach, the gastric acids are going to come in, and this mother is going to be subjected to gastric issues, when the acids are there, epigastric pain, yes. So if that comes in, we tell them, get something to eat on all the time. Have a bottle of water. If it is not because sometimes water, they don't like to take it so much. So you can
Mm.
get like orange juice or something to eat on every time. Have something you're eating and it is going inside, however small it might be. It will help you to reduce the nausea, and it will help in reducing the spitting thing. And most of the time they get the nausea because of an empty stomach. They don't
Mm.
want to eat. They have anorexia now, so they feel like, I cannot eat. So they are going to get the nausea because of the empty stomach. So when they start chewing on these different things and they're taking them down, the nausea will be low, the spitting will be low. Even she will have energy by the end of the day, because she's going to be eating food which is going to help her get energy, however small it may be. Some other complications like sleeping disorders. Some others, they get insomnia, they cannot sleep the whole night, they are awake. So some of them have stress, which is making them not to sleep,
Mm.
pregnancy related stress.
Mm.
The body is changing, the breasts are very big now, the abdomen
Mm.
is big, and sometimes it's the hormones which is making not to sleep. So we advise her that if you cannot sleep at night, find
Mm.
something that is going to keep you busy throughout the night so that you don't overthink about stuff. And during the day, get time to rest the brain because it will need to rest. So we tell them that this is a normal thing. Most mothers are getting it. Don't stress over it. If sleep has not come, do some activity. You can read a book. You can do some exercises that will help you get to sleep, like take warm baths, walk around outside, then enter. You're going to enter when you're cold. Now you'll be able to sleep well. Talk to your husband, let him cuddle you so that you feel safe, not to start thinking of things.
Yes.
Yes, so most of these minor disorders, they are there, but we handle them, or we treat them compared to the situation that is bringing them. Yes, sir.
Actually, sister, this is where the husbands come in. Really, if you see your wife is fatigued, this is where we need to be supportive. If you cannot have a maid, there are things you can decide to do. You can tell her, since you didn't sleep at night, it's okay, sleep during day. I will do ABC. Maybe I will leave the food, or we can buy food in a restaurant. Or, if you realize she's becoming addicted to certain types of foods, you can tell her, okay, eh, don't be that traditional man. I'm a Muganda man and a traditional African man, but at that time we need to lessen our traditionness and accept what you're going through. Like I said, let pregnancy be a journey of the couple and not a journey of the woman. Because
Yeah.
if I'm walking with my friend and I realize she's getting tired, I'm going to hold her hand and then I say, let us finish together. If I realize that, oh, my friend no longer loves to do ABC, I'm not going to keep saying, oh, but me, I want you. Go, go, you're the one supposed to iron my clothes. You're supposed. No. Let this be a journey of love, a journey of showing support. Dear husbands watching with me today, this is the most important time that you can be there for your wife. The issue of looking for money is okay, but the issue of supporting her, actually at this time, it's like paying child for your school fees for your child. Even if you're paying in time, but you don't go to visit her on visitation days, she'll tell friends, I have the worst father, even if you pay school fees on day
Yes.
one. So this is a time we are supposed to show our women that actually we are in this thing together. Stop stop abandoning them for 9 months and you come to give names. And moreover, you come to give name and you give a very long Luganda name. Because Onomana wa Chikachi, she belongs to this. But throughout the 9 months, you are nowhere to be seen. Again, you said
Yes.
if she cannot sleep, there are some things she can hear, she can read books. But as well, if she wants to get some sleep, she can also go through the husband's phone. That could be one way to help her find sleep.
The
Okay.
phone will not help her.
So many questions are coming in, both in my inbox and on someone is asking about sex positions. We shall talk about that later. She's about if sex is safe or not. Sister, let us. There are so many things that we normally tell women the do's and don'ts when it comes to medication and food in early pregnancies. Why do we say most medicines are not recommended in the first 3 months of pregnancy? And when it comes to medicines, but also when it comes to food, it is two-way. Some people fear to eat so much because some people have told them if they eat so much, they are going to put on so much weight that they cannot shed off after birth. But you're here telling women to eat because the baby is depending on them for survival, and because it's like soil before we plant in something. Truly said taka. I mean, you put fertilizers there because you're going to put a seed. And I can say that's the same that is going to happen for pregnancy. The baby is going to grow in, so we are nourishing the body to build it, to make it strong enough, to make it lively for the baby. What do you say about drugs in that pregnancy and and also foods?
Okay. As we all know, in the first trimester, that is from the time you've conceived, that is first day of conception to that 12 weeks of pregnancy. That is where we are going to see the baby forming. Yeah? It's where we have the two cells, the sperm cell and the ovum, and and the ovum. There are two. They are going to become. They are going to multiply into many cells, forming a zygote, which will form a blastocyst. Is the blastocyst that will implant in the uterus, forming where we are going to get an embryo. Then from the embryo, we get the fetus. So with all these processes, we all know the drugs that we take inside our bodies, they go through the whole bloodstream. So if you take a drug that will hinder the multiplication of these cells from forming one thing to another, leading to another, leading to the baby that we shall see, because the baby is the end product. But before we see the baby, there are things that have happened to make this baby. So when we take some drugs, they inhibit the formation of some cells. That's why we say that when you know that you're pregnant, there are some people who have chronic illnesses like cancer, TB, but they still can get pregnant. When you know that you have you want to conceive, that is, we go back to the preconception care. You see your doctors and ask them, are the drugs which I'm on safe for me to get pregnant in the next 1 year, in the next 6 months, in the next 3 months? So they'll advise, they might even reduce on some of the doses, they might withdraw some of the drugs so as to prepare the body to conceive. Yes, so that's why we say that before conceiving, first know who you are, what am I on, then get the right advice from the right people before you take it on. Because these drugs, most of them are very dangerous. They can hinder the cell formations to make the baby now. That's why we say get drugs which are prescribed by a doctor. Do not prescribe yourself. Even if it's a simple headache and you say, let me take some trap. May I take trap all the time? It might cause some harm to the baby. The baby might form. We can get some preterm deliveries, abortions, or even complications, genetic complications on the baby now who would have developed. But most of the times, we are going to see abortions or preterm deliveries just because of the drugs that we've been taking, which are not safe in pregnancy. And when you go back to food, yes, some food is good. But as we all know that food is medicine, dagala. So if food is medicine, it means that it has some components of these medicines in them. So there are certain foods we say that if you're to eat them in less amounts so as not to complicate the pregnancy. Yes, like the foods which have a lot of vitamin A. We because we don't need the vitamin A right now. We shall need it after delivery. So we tell the mothers, don't eat a lot of those foods which have a lot of vitamin A in them because they can hinder the formation of the what? Of the fetus. Yes.
Again, the reason we wake up every Sunday to be on this program is not to show off or is not to look because we have nothing to do. But we believe there is a person there that needs this information. There is a person out there that does not have money or time to go for medical visits or for medical appointments. But we still say we are here to pass on knowledge, to use it to make better healthcare decisions. Let me tell you, the more we learn about health, the better we are going to make healthcare decisions. It is absurd that in this era of time, we still lose loved ones or children because of errors that we can avoid. This program is specially dedicated to all my single female friends that are scared or that are planning to have children. I brought for you Sister Banula because I knew she's experienced in that field, and I believe you're picking all the positives. So come 2026, Operation Babies, let's go. Babies due, babies due, babies due. So, sister, moving away from that and going to antenatal visits, how often should antenatal visits happen, and what should mothers expect on the very first time they visit the hospital? But also, lastly, when should actually mothers visit hospitals for antenatal when they realize they are pregnant? Or if a mother is sure I got pregnant on this date, when should she come for the first antenatal visit?
Mothers are advised to come for the first antenatal visit. That time she knows that I have missed my period.
Okay.
Because when we don't see the period, it means that we are either pregnant or we have some stressors that have delayed the periods. So when she's sure that, yes, I have missed the periods, she comes to the hospital for confirmation of the pregnancy. And if the pregnancy is there, we start on antenatal business. Right now in Uganda, the Ministry of Health is advising that a mother should at least visit the hospital 8 times. Back then, there were 4 times during pregnancy, but now there are 8 times. Why? They put all these times we have to visit the hospital to identify risks and to manage before we get complications of the pregnancy. Yes. So we identify and treat.
Okay.
Yes. Antenatal visits, as I say, there are 8 now. The first visit is that visit that you're going to come to confirm that, yes, I'm pregnant. And this has to happen for the first 3 months. The mother should not miss visiting the hospital for the first 3 months when she's pregnant. Then after there, we can give her like 8 weeks to come back to hospital. 8 weeks is like 2 months to come back to hospital. And on this first visit, mainly, we are going to confirm confirm pregnancy. We are going to screen the mother for these chronic illnesses. We are going to screen the HIV, high blood pressure, DM, syphilis. We shall not do any immunizations then, because it's going to be confirming and to screen out these illnesses. And we shall start her on the folic acid now, because as I said in the first slide, that folic acid is key and it is very essential. So since we are still in that forming phase, we are going to start her for the folic acid, which will help her in the formation of the embryo. So the mother will probably come back after, or if she comes when the pregnancy is 2 months, she'll come back now when the pregnancy is around 4 months. Here we shall 4 to 5 months. Here we shall still continue with the screening, because as you know, the pregnancy itself, you might not be having high blood pressure, but because of the pregnancy, it develops. We are going to check out for, still we screen for these the illnesses, high blood pressure. DM, we shall not be doing it again. We shall be doing urine tests. Urine tests to check out for the proteins, just because of the high blood pressure. To prevent to identify the risks of preeclampsia. We do the urine tests. We shall give the immunizations, the routine immunizations according to what you've not got. Here we shall be giving the mother tetanus injections. Now we give tetanus diphtheria. Those days we used to give tetanus toxoid. Now we are giving tetanus and diphtheria in it. If we screen the mother and the mother does not have hepatitis B, we shall go ahead to vaccine the mother with the hepatitis B vaccine. Yes. The mother will come back after 1 month now, when we go in the second trimester. So every month, the mother will be visiting the health facility, but mostly what we shall be doing is screening, doing the vitals, that is checking for the blood pressure, checking for temperature, checking the weight. As I said, BMI is key. Some others, when we are pregnant, we tend to put on weight, and the recommended weight is 2 kilograms per month. So you might find a mother who is putting on 5 kilograms in a month. That is a risk, because we are going to be thinking of DM now. Is the mother going to develop diabetes because of this large increment in the weight. Yes, so we shall be doing health education talks. Health education talks, as I said, every time the mothers come for antenatal, still we do these routine health education talks, talking about different things, sensitizing the mother on the different things, and preparing the mothers for labor and postpartum period. Yes, so every month the mother will be coming. Every month the mother will be coming. So when the mother clocks 36 weeks, that is in local language, the mother will be 9 months now at 36 weeks. This mother will be coming every after 2 weeks until she delivers. We no longer tell them that you go now, you're 36 weeks, you go home and wait for labor. Those days we used to say, you go and wait for labor. No, these days we don't wait for labor at home. The mother continues to come to hospital until the day she gets her labor period, her labor pains. Yes. And in these visits, as the mother is coming to antenatal, we advise the mother to do certain scans. In the first trimester, that is the first time when the mother came to hospital, we advise the mother to do the first scan. Usually the recommended scans, there are 3. The first one, we do it to confirm pregnancy. After confirming pregnancy, we get to know where the fetus is growing from. Still in the first scan, we get to know how many babies are developing or are going to develop in this mother's womb. That is the first scan. Here in the first scan, we're not going to talk about abnormalities because the baby is still forming. It's mostly confirming pregnancy, identifying where the baby is growing from. Is it in the womb? Is it outside the womb? Confirming how many babies we are expecting to grow in this pregnancy. So we shall do a second scan. The second scan will be done when the baby is around 20 weeks to 26 weeks. That is from 5 months to 6 months. So this scan confirms abnormalities, or if our baby is okay and has no abnormalities on the body or inside the body. It is the only thing why we do the scan at that particular time. Another scan, the third one, will be done as we are nearing labor. That is around 36 weeks to 38 weeks. Here we want to know how many kilograms does this baby have. We shall be seeing what is the position of our baby now in those last weeks. Is it will the mother afford to push, or it will be a difficult delivery? How much liquor is the water on the baby? How much liquor do we have? Where is the placenta situated? Is it below the baby or in the right position where the placenta is supposed to be? So in all those visits, we have different activities which are being done, but mostly those are some of the activities that we do in those different visits that will come to the facility for antenatal care. Yes, so every time the mother comes, there is something she's going to do which will help prevent and promote health during pregnancy, labor, and puerperium.
Thank you so much for that thorough explanation. Again, I would just love to re-echo this to men watching with me. You see, working in the hospital taught me so much about the experiences of pregnancy, not as a father or as a husband, but as a health provider. That sometimes these women come without knowing exactly what tests or procedures they are going to do. Because I want to remind all the men that each woman is different. A woman that is giving birth for the first time, sometimes they are not handled like one who is giving birth for the 7th time. Because there are things that they know. For example, blood group is not going to change between the first child and the last child. So sometimes the tests and investigations they are going to ask this woman to do could be different. But so when you escort them, you come to understand why they are asking you for that money or why they are spending that money. Don't start saying, nenze nalongo azadde abaana 8 naye tebamugambangako kukola kino. No, nalongo is not this young girl that maybe you've just gotten. Like Musao explained earlier, it could be that your rhesus factors have issues that she needs to be given and B, but nalongo and your blood maybe do not whatever. But also the other thing is about ultrasound scan. Because I'm an imaging technologist, I will speak about that. That so many times I've seen women that come claiming they are 6 months pregnant, and you do a scan, and so many things you see. Number one, sometimes you realize they are not pregnant at all. Their uteruses are just expanding simply because they are fibroids in them, but they are 9 months pregnant, and sometimes surprisingly they have gone to some private fertility facilities. They have even given them antenatal cards. Now that's what used to hurt me the more. A woman has an antenatal card, but she's not pregnant. She has a large fibroid that keeps expanding. Sometimes this woman, the HCG is positive. Yes, but she has what we call a molar pregnancy. And this molar pregnancy is expanding per age. Because it's just a pregnancy that maybe just got spoiled or due to one way. We shall discuss that in another discussion. So this first scan is actually, to me, one of the most important scans, because sometimes you're pregnant, but the pregnancy is not in the uterus. You're having an ectopic pregnancy. Where I am right now, the moment you confirm the HCG is positive, you don't leave the hospital before stating the location. Because so many women were getting ruptured tubes due to ectopic pregnancies. Now, this is what most of you do in your buzigos. You miss period, you go buy a strip, you test, oh, it is positive. You now wait for time until when you start getting complications before you go to see Sister Gertrude. You wait, either you're having issues, if everything is going on well. I never go to hospital because everything is having, especially women that have had a child before. You think now you know. You even start telling your friends. But the first time I was pregnant, twali tugenda yo bugenzi nga batuwa budagala. Sometimes even not the budagala, you start buying them yourselves.
Yes.
The first pregnancy is very important. For number one, the other things of numbers, Musawa said, to me, location of that pregnancy. If that pregnancy is not located where it's supposed to be, the endometrium, and it's anywhere else, it is a risky pregnancy that is supposed to be terminated. Now, when we say termination, long time ago it used to be abortion. These days there are drugs they can put in your body. They are going to go and press, somehow kill or damage that baby, wherever it is, that you no longer need to go for an operation. It is going to be damaged, and then eventually the body is going to get rid of it, actually without your knowledge. But if you don't do that in time, imagine your baby is going through, when you say tubes, fallopian tubes, imagine a thread ooze. Now a baby is trying to grow there. Time is going to come when the baby becomes too big for that tube and it's going to burst. You're going to start getting internal bleeding. Now it's going to be an emergency. And then when you go to hospital and maybe you find there is a line, maybe the theater is busy, you may end losing up your life in that waiting. Now we put the blame on the health facility. Oh, I took my wife and we were not handled. There I was doing this. But you didn't do the simplest responsibility of doing a scan that costs between 20,000 to 50,000 almost between facilities to just find out the location. So that's why I say that sometimes when I see these complications or mothers dying, I don't want to blame, but to a big extent, there was delay or someone somewhere did not do, and most of the time it's on the patient, the mother or the couple side. The moment you miss your period, go to hospital to confirm pregnancy and location of pregnancy. If you don't have time to go to Rubaga, okay, find an ultrasound scan and do that scan for them at least to have that report that the baby is in the right procedure. It is going to save you. But also, very important, Musau talked about the other investigations that are supposed to be done. Some of you are having issues. Some of you are on having chronic illnesses like HIV/AIDS. With HIV positive patients, they need to prepare you right from the time you become pregnant. They need to prepare you psychologically. There are drugs sometimes they are going to give you to prepare you or to help the baby grow. Some of you are hypertensives. Some of you are diabetic patients. You need that advice from qualified people. And again, I always tell my mothers, there are so many professions when it comes to giving birth. They are gynecologists now these days. They are clinic embryologists that assist in artificial fertilization and everything, and then they are midwife. To me, my profession of choice are midwives. I one time said this statement, and one gynecologist said, "Oh, I said yes." Number one, how many gynecologists do you have in the community where you are? I'll tell a story of a gynecologist I know who, when I escorted my friend's wife, was monitoring about 7 women almost in all hospitals in Kampala, and the guy was kept driving. At one time, he jumped on a border. He's checking on the one. At the end of the day, ended up operating all of them because he could not chase anymore. Okay, and one time one woman was asking, why are there so many cesarean operations happening of late? And I told them, it's because most of you, instead of getting fast things from midwives, you're seeking gyno wange. Go to midwives and get the basic knowledge you need to learn. If you need a gynecologist, the midwives will recommend you to one. But the things of seeing a gynecologist who's even fees you can't even manage. I mean, you cannot even manage the appointment fees. So you're seeing one guy in 9 months because you even can't afford them. And you think, oh, this midwife is not important because I'm seeing a guy in. Oh, these midwives deliver more than 30 mothers every day. They have experiences of about 1,000 deliveries. I'm not pinning down gynecologists, but I'm saying see your midwives for attention. Sister, lastly, as we conclude, I know husband needs some attention, and that is very good. I love husbands that are very responsible. Sister, let's talk about now the negative things coming in. What are some of the signs that this couple will see and know there is a problem, we need to rush to hospital in the first trimester?
Yeah, in the first trimester, we call them the danger signs. Danger signs, these are signs that have a harm to the fetus or the mother herself. Most of the times we might we are going to categorize them, the fetus and the mother. For the fetus, if a mother sees any vaginal bleeding, that is bleeding from the private part. When we are pregnant, we are not supposed to see any blood because blood comes when we are in our menstrual period. So when we are pregnant now, blood has sealed off. So we advise the couple, if you see any blood, it means the baby has a problem, because that's why we're going to see abortions. Yes, mostly abortions, missed abortions. Yes. So if the mother did the first scan on confirmation of the pregnancy, she'll know that she does not have a molar pregnancy and there is no ectopic pregnancy. So she'll know that the pregnancy is inside the womb. If she experiences severe abdominal pain, because we cannot talk about contractions, at around this time, they are not contractions, they are cramps. And to many, it will be a severe abdominal pain where the mother cannot sit, cannot do anything. There's too much pain in the abdomen. We advise them to quickly rush to the nearest health facility, which is trusted, because as you know, these days we have many in our communities where they open just to get money, but they don't come to give us the right service. if a mother gets a headache, there is headache which you can afford. You sleep it off, you drink some water, and it is off. But there's headache, throbbing headache. You cannot even see what is going on. The mother cannot even stand. The mother cannot sustain herself. This is an issue that the mother's body now has a problem with the pregnancy. So now we are on the mother. So the body is responding that there is a problem we have with the pregnancy. This might be showing us that the mother might develop a risk of high blood pressure in pregnancy, which we call preeclampsia. Because when you're pregnant, we don't talk about high blood pressure. We talk about preeclampsia. So if the mother reports too much headache, and the husband or the caretakers or the mother tell you she fell down and she started convulsing, those are all danger signs to our mother now. Excessive vomiting. As you know, when we are having a molar pregnancy, the vomiting is more than normal because it is not a right pregnancy. So if they report that this mother is having excessive vomiting and she tells you, I cannot eat anything, not even in the morning, not during day, not at night, everything that I take in comes out. It means that even if the pregnancy is okay, but the mother's body is not fine, she's losing a lot of water, she's losing a lot of nutrients, she's losing uh, a lot of vitamins. When she's vomiting, it means that it can also harm the baby. So we need to come in the hospital. They give you other alternatives other than taking down the GIT. We use other routes to maintain these nutrients inside your body to maintain you and the growing baby. Yes, so there are like 6 of them, whereby if you see them, rush to the hospital. We talked about vaginal bleeding, excessive vomiting, a throbbing headache, which will be accompanied by a convulsion, excessive vomiting, even hotness, by the way. If the mother tells you, "Masa, I'm having a fever," fevers are never good. Because if you're hot outside, inside you're hotter, and the baby cannot be in those two increased temperatures. So even fevers, they are not good. So there are like 6 or 7 danger signs which you have to watch out to come immediately and to the nearest trusted health facility.
Again, I want to thank you, Sister Gertrude, for being with us up to this time. Thank you so much
You're
for
welcome.
allowing to welcome Ugandans. Again, to everyone watching in there, we are going to have self-care dinner come next year in June. The venue will be communicated, and you're going to physically come and interact with all these people physically. Every person you've seen presenting this year on this channel is going to be there. We are going to meet them. We are going to invite them with their partners, husbands, or wives. We want to have a dinner as the family of self-care, because these are the people that are helping to teach the community. We realized that internet was used by all the other people apart from the healthcare facilities. So this time around, we want to hang out with the team of your experts. Sister, as we conclude on this presentation today, Solomon Nakato has a question. You know, Solomon is one of our very dedicated followers, my friend. She's asking, I know she's asking, she's saying talk about sex during pregnancy. And actually, this is a question that so many people have. And it has mixed feelings. Some people say sex may lead to miscarriages, and people say it's very healthy. What's your take on intercourse during pregnancy?
Yeah, during pregnancy. In the first time, we got pregnant through intercourse. So it means that it is a positive other than a negative. Yes,
Yeah.
sex during pregnancy it has its own benefits. Yes, very many benefits. But
Yes.
before we go into it, there are some mothers
Yeah.
who get complications and they tell them that because of ABCD, you're not allowed to even go out of bed. You're going to have a bed rest. Just go to the toilet, shower, come back to the bed. So there are some complications whereby which the mother has, which will not enable her to be into intercourse. And some others, they are pregnant, but they are in hospital, bedridden. They got accidents. Yes, the sex cannot be there. But if the mother is okay, the body is fine, the husband is okay, we tell them that please and please have some intercourse, not some, have regular intercourse. Why? The benefits. One of them is it's going to create a bond between the wife and the husband. As you saw earlier in the complications of pregnancy, we saw that some psychological, emotional, uh, emotional complications this mother is going to get. So the more the husband is distant, the more the relationship is going to become distant also. So the love will decrease slightly but steadily just because of that. But whenever they are together, they have had their rough days because of the hormone problems. But now the husband is cuddling the wife, they are together, they are warming up. They tend to forgive and forget what happened throughout the day. Even if the husband did not accompany me to the hospital, I came back home very annoyed with him. I cannot sit with him. We were in the car, everyone was looking south, the other one was looking north. But when you come back to that negotiation, you're going to forget what happened during the day. So it creates a bond between the wife and the husband. Secondly, there's the dad and the baby growing in. That's when they get their first contact.
Yeah,
The
yes.
uh-huh.
Sexy Jew.
The baby, they tell us, Jew, they tell us that at 7 months, the baby
Yes.
knows everything that is going on. So it means
Oh.
that whenever you have those intercourse, those interactions with your husband, the baby is going to have a positive attitude towards the dad now, because he or she will be hearing the voice of the dad, all that. And another thing, it helps in widening the how do they call it? The pelvic girdle, that where the baby is going to come from. So it is one of the exercises that we do to enable to enable us to push the baby. Because whenever you're having those exercises, the pelvic girdle is expanding. So it means that when the contractions start, it will be something that the pelvis has been doing it. So it will be easy for it will enable us to push, but not all that everyone who needs to push has to do that. In Uganda,
Yes.
we call it okumenya. It helps in okumenya.
Yeah.
And another thing, the good thing with it, this semen, it has some of the hormones which help us in getting the contractions. Am I communicating?
You are
The
communicating. I represent millions of men that were just waiting for that
uh-huh.
answer.
Yes, so they tell us, science tells us that in the
Yeah.
semen, God was very clever. He knew that
Yeah.
this baby had to come out eventually, and
Yeah.
sometimes the mother's contractions or the hormones that are going to initiate the contractions in the uterus, they might be few. That's why he created the man to put the baby in and to help in removing the baby when the time is due. So these I've forgotten the name they use, but they go in those no, those receptors that help to make the contractions become more, so that contractions can start and we see baby out. So the stamen helps us in the delivery part of it. It becomes like oxytocin. Its activity is like the oxytocin shot that you're going to give a mother who has less contractions or who's not progressing well. So that's where the stamen comes in. It increases, it it boosts on the contractions. They will not start immediately, but the more they go in, the more they accumulate in the receptors, and the more they accumulate, when time comes, things are more smoother. Yes, so it is very
Wow.
vital, and we should we should encourage couples to do it, just because most of the times some women, because of the hormones, they tend to feel like I cannot. And when they see this part, whenever as I say that the private part is because it's going to become more bigger, and it will be tense. So she'll be like, she'll be feeling pain. But remember, I said that there are more fluids now. So she'll be like, there is pain, but it will not be pain. She cannot, it's not pain, it is a discomfort. So we tell the husband, just go slow with it, and adopt to a position that she's comfortable to, so that you can enjoy it more. Because in pregnancy, it is more enjoyable for the husband, just because of those big changes which have happened down there.
So, in a nutshell, today, 1,000 men that I'm representing now, sexy Jew, a mundo evuge.
I mean,
Now, sister, last one, this has come through my phone, all the way from Canada. Someone is asking, sister, you're going to talk about short women. That there is a misconception, or not actually a misconception, where they say short women have issues delivering, abakyala abampi, and also your small pelvic girdles, where they say you do examination and you advise these women on pelvic girdles. But as you prepare for that, let me answer this. This is Ronald Kajege saying, you talked about scanning the location of the pregnancy. Should it be done immediately after one realizes that she has missed periods? Is it visible there and then? No. From my experience as imaging, when we are scanning, of course, in the first 14 days of conception, we are going to have hormone changes in urine and blood. We can determine pregnancy in urine and blood. So yes, if a lady came and they say that, they are going to tell us their last normal menstruation period. If we calculate and it is less than 4 weeks, most of the time we are not going to see anything on scan. But also it depends on the type of scan. In America right now, we can start to see the first changes of pregnancy at 3.5 weeks or 4 weeks. That's when we have the endometrium beginning to thicken above the normal dimensions. But normally, most of the women are going to see missed periods after 21 to 28 days or a month. So most of the time, by the time they come to hospital, they are within that window where we can see the first sonographic at least signs of pregnancy. That is either thickening of the endometrium. So yes, we are saying rather than them calculating and waiting, is it visible or is it visible now? We are saying the time they test positive, let them come to a health facility, a scan is done. If the sonographer sees that at the time they have come, there is nothing they will see, they will communicate that. But also, if you do a proper endovaginal scan, you're able to see some of these actually developments earlier than even 4 weeks. But at 4 weeks and above, we can clearly start to tell this is IUP, this is an intrauterine pregnancy or non-intrauterine pregnancy, and then we can follow up. That's how I can answer that. So sister, lastly, I close the show with answering that question on short women, a conception that short women cannot push naturally, and then also talk about what are small pelvic girdles and all that.
Okay.
Yes.
Thank you very much. Short women, we can push. Even me myself, I'm short. We can definitely push our babies. The problem is, all women, when we are, we can all push, but the problem comes in when we do an internal pelvic assessment. An internal pelvic assessment is done on all pregnant women. This internal pelvic assessment used to be done on during antenatal, but these days it has changed. We do it during labor. we want to see if the pelvis inside there, it has an adequate space for the baby to accommodate the baby's head. As we all know, the baby's head is the biggest part of the biggest body part on the baby. So if this pelvis of a given mother can adequate the baby's head compared to the baby coming, we have what we call the passenger, passage, and the powers during delivery. So the passenger is the baby. How big is the baby? The pelvic might be very big, very adequate. But when the passenger who is coming is bigger compared to this person's pelvis, and we have the passage. How is the passage? So here we are talking about the passage. The passage should be adequate. When we see the pelvis itself, it is bony. It is all bone. These are the tissues, they come to close the bone, and the muscles, they come to close the bone. But when we come to assessing, we are assessing the bone part of the pelvis now, because it's the one that will inhibit. The bones don't expand and they don't reduce because of the hormones. It is the muscles which will do all that. So when we are checking the bones, should I state the bone's name? But I think it's not. So it is like a Benson. There's that bone up there. When we do an internal pelvic assessment, if a person who is doing a VE can tip that part of the bone up inside there, it means that it can be an obstruction to the coming passenger. We have in the middle here of the pelvic bone, we have what we call spines, or the ischial spines. They're on the ischial bones. If they are prominent and the person who has done a VE can feel those pointed part in the middle of the pelvis inside there, it means these spines also, they can become an obstruction to the coming passenger. So we have the outlet. Now we are outside. If the person doing the VE puts the fist between those bones, there are two, this side and this side. If the fist does not fit there, it means it might be an obstruction to the coming passenger. But these all don't mean that the passenger who is coming will not fit in. All these we might feel them, but when the passenger coming is slightly smaller compared to what you have examined, when the passenger can go through the passage, and the given powers, those are the contractions, when they can help the passenger pass adequately without any hesitation or hindrances. The Batwa people, they deliver. Batwa are one of the shortest people in Africa. They deliver their babies very well. Why? The mother is short, the father is short. They are going to deliver their short baby according to their genes. They are going to deliver their genes. So it doesn't mean that short people, they don't deliver. Even tall, huge might fail to deliver because of the formation of the pelvic girdle when their bones are protruding here and there. Yes, so all of us, we can push, but it depends on the passenger who's going to pass through the passage. Yes, sir.
Sister, I think that explanation also takes in women with big nyash, because there was also another that women who have big nyash also have issues, but I think you've answered it well. But it clearly takes back to one thing: let's have preconception plans and visits. All this discussion, that the things that you're talking about, these are things you're supposed to be having with your midwife shortly before. As we close, again, I want to thank everyone that has watched in ever since we started. Olivia from Mukono, our friends from Canada, our friends from California that are watching in right now, our friends from Uganda and everywhere. Our role is simple every Sunday, is to inform you so that you make better decision making. Again, if you would love to be part of the dinner that we are going to have in box Chimbo 880, we shall send you your ticket and we shall tell you the location, and you're going to come physically to interact with all these people one-on-one and ask more questions. But also, if you would love to privately consult with any of these people, write to us at Chimbo 80 gmail.com, and then I'll share their contacts with you. You go and meet them. These are professionals. Every person that appears on this channel is a professional. Like, people that are close to me know that all the herbal companies in Uganda have offered me sponsorship for this program. They want to appear, but I told them to send me proof that they studied what they want to teach people. So if you want to go to Sister Banula, imagine a midwife. Imagine someone smiling, that beautiful, taking care of your beautiful wife. I think, I mean, everything is going to be positive. So if you're looking for a midwife, go to Rubaga, ask for Sister Banula, and tell her you watched Mr. Selfcare recommend. Trust me, that is the best pregnancy journey you're ever going to have. And again, remember to pray for these people. I worked with midwives in Nagu. These are people that are ever bending and standing up. What you call a shift of 10 hours, maybe she has delivered 15 mothers. And I'm telling you, delivering one baby, I've watched one being delivered. It is something that I will never ask God to put me. These people deliver. For every human being you looked in that tax was delivered by a midwife. So as you pray for the country, as you pray for peaceful political season, remember to pray for the midwives in Uganda. Let us advocate for their better pay. Hospitals, please pay these people well. It hurts me that you pay doctors that just come for hours and tick papers and sign and go. And the midwife that are delivering our children are paid peanuts. To gynecologists working with midwives, please pay them. As you're billing the patients for private work, include a midwife fee. These people handle our women well. These people are the people that teach our women how to breastfeed, how to do things. It hurts us that I pay out of the millions. There is a big percentage for a surgeon, for a gynecologist, and my midwife is taking none. And then for patients, please. I don't advocate for bribes, but appreciate the midwives. Get that hen or chicken and take to Sister Banula and you say, I've paid Fantinento, but Sister Banula, go and eat, go and whatever. If you're rearing, you're growing butunda nyanya, you don't have money, these people appreciate. Let us appreciate them while they can still listen. The issue of making long statements when God has called them does not matter. Appreciate midwives everywhere. Again, thank you so much for watching this show. We shall be back next Sunday with the last part, that is third trimester, second and third trimester, and the process of giving birth. And lastly, we are going to wrap up this month of November with a discussion on postpartum depression. Because so many mothers go through that, so many families have been broken because the men feel they are not caring for them anymore. But the issue is not with the women. The issue is that they got postpartum depression that was never detected, and they lost love. They put all the love to the baby, or they lost love for the baby and the husband. So before you complain, let's seek to understand and help them. Sister Banda, send your closing remarks to everyone watching, and your handsome husband that I'm sure is holding the phone or the light in front of you.
Thank you very much, sir, for this opportunity.
I can smell love.
You have given to me to be able to. Thank you for the opportunity given to me today to talk to the people, to our lovely congregation. As you've stated very well, most of the women will go through a lot of depression right from pregnancy to postpartum, just because we don't know what is really happening, and sometimes we are not sensitized on who to ask. Sometimes we ask the wrong people and we get the wrong information. I'm glad that I'm one of those people who is readily available to educate the nation and to change the way people perceive pregnancy and the way people perceive marriage itself. Yes, I send greetings to everyone back in my lovely hospital, Rubaga Hospital. I'm privileged to be here. It's Rubaga Hospital that has framed me to this. I was not like this, but now I can speak to people and I'm knowledgeable. I thank so much my hospital and my lovely husband. Yeah, as you said, he's right here. He's here watching and encouraging me, as he has always been doing. He's my strength, my pillar, The one thing that I cannot live without. We've been married for over how many years, Sita? Many years, like 18 years. 18 years we are in marriage and still counting, by the way. Very happy. My lovely children, most of them are at school. Here I have one boy, Ethan. He's also here telling me, yes, mommy, you're doing it.
Mommy
Yes.
Jew.
My lovely parents, my mom, my sisters. I'm very humbled for the support they have given me on this show.
Yeah.
Thank you very much. I'm privileged to be here.
Again, I want to thank all our viewers. Thank you so much for taking the time. After watching this video, make sure you share it with someone. You don't know who needs this information, and together we can do something. Again, I want to thank Sister Gertrude on a short notice. I remember when I sent you that message, Sister Gertrude, I need you to come. You said, anytime in November, I'm available and I'm willing. Thank you so much for allowing. Especially not to Rubaga Hospital. I think out of the people that I've hosted on this channel, 60% come from Rubaga Hospital. For some reason, I don't know. They are very receptive. They are very open to discussion. I think the management of Mr.Selfcare is going to prepare an appreciation certificate to the management of Rubaga Hospital, thanking you for accepting to partner in educating the masses. And I call all other hospitals. This is space that we are supposed to use. I've really have so many questions regarding dialysis, but I've tried to get in touch with the people dealing with dialysis. I've so far failed. But this is one way we can help educate the masses. Modern medicine is not about treating diseases because we cannot treat 5 billion people, but we can prevent diseases. And I believe for every professional, there is something that we can do to prevent diseases. Imagine if all the midwives were hosted on different spaces like this to just talk about the journey of pregnancy. How many deaths would we avoid? And again, for all the husbands that are supporting their women, I think the last show on this year, I'm going to host Happy Husbands. If you feel your husband is happy, come to my inbox. I'm going to host them to just tell us who are just coming into that profession of marriage, how do we make our women happy? How do we deal with our phones that have more than 4 passwords? How do we come back and we are annoyed, but we are still afford to have a smile? Again, from Mr. Selfcare, I want to thank you for watching this show and have a blessed Sunday. May God bless you as you go to church. Remember to thank God for life, because it's a gift that we take for granted. But on Monday, I almost lost my life in an accident. Now I know the value of getting back home and the value of oxygen and every minute spent. From me and the management, have yourself a blessed Sunday. Bye.